He's like, I see physicians just leave their personality at the door, sort of. And he's like, just don't lose that, basically. This is what I remember him saying to you. I try to say that to the medical students too. And really, I think for people in any career or walk of life, retain your unique personality. And if humor is part of it, or if it's, sensitivity or whatever it is, don't feel like you can't show that because I need to be professional or I have to establish myself as an authority, because I think your personality is what makes you you. It's what allows people to be at ease and connect with you, and your expertise and your hard work and your seriousness when it is appropriate and needed will come through and speak for itself. So just use humor and keep your personality. It was like, so I was flattered that he said that to me. And then I really took it to heart and tried to share
I
it with
love that.
people.
Can you do me a favor? Can you look in the camera and say like, comment, and subscribe?
Like, comment.
Like, comment, and subscribe to my channel. So to my grandson's channel. Say like, comment, and subscribe to my grandson's channel.
Like, comment, and subscribe to my grandson's channel.
You heard it. Okay, welcome back to If I Knew Then. Today I have Maureen Braun. She's a physician at Children's Hospital of Philadelphia, and actually my children's pediatrician. Initially, we were with someone else in your practice, and she left on maternity leave, and we were super nervous because we liked her a lot, and we were only with her for maybe a couple of months max. It was during the height of COVID, so we were lunatics.
Yeah.
And we just happened to get
anxiety was like,
yes,
exaggerated. And
and we happened to get you next, and we're like, listen, I'm sorry, we really like our other doctor. And then from there, we became like, we love you. We've moved out of Philly, and we still drive down to come back to you. So
it's been such a joy to take care of your kids. And I definitely would not call you a lunatic. You're like an appropriately anxious parent. Your energy resonated with me. So I was like, I can relate. But yeah, it's funny now how long it's been, because, time flies.
I know it is crazy. They're growing too fast.
Yeah.
But thank you very much for doing this today. Before we go any further, can I turn it over to you to introduce yourself and tell us a little bit about what you do?
Sure. Yeah. So like you said, my name's Maureen Braun. I'm a pediatrician in Philadelphia. I've been at CHOP for like 8 years now, I think.
Okay.
I trained at Mount Sinai in New York and worked there for about 4 years after residency, and 3 years of residency. So I was in New York for 7 years, and then we moved, to Philly so I could come to CHOP. And I live in the neighborhood where I work, and I have 2 kids, 2 daughters, 10 and 8, who, like you said, are just growing too quickly. I can't believe I was pregnant with my second when we moved. So, yeah.
Wow. Very nice. All right. Thank you. So can you tell me, before we get into your current role, can you give me a little bit about your journey? I'm always curious. Did you always want to be a pediatrician, or did you always know you wanted to be a physician and you weren't sure what field? How did you end up where you are?
That's a good question. Sometimes I think back about it, like, how did you end up, or how did I end up where I am? I didn't always want to be a doctor, but I think it was always on my list of possible careers that I think I was interested in pursuing. I was really interested in like service and working with people, serving people. So I thought I might want to be a teacher or a social worker or run a community center. I volunteered in high school at a community center. So those were the sort of things that were in my head. And our really good family friends, it was a couple, the husband was a doctor and the wife was a nurse practitioner. I went with them to like, take your daughter to work day, even though both my parents also worked, but my mom was an accountant and my dad was an engineer. So it was like not that exciting. And so I always sort of had that in the back of my head. And, it was my friend's parents were the family friends I'm talking about. And my friend's mom said, the great thing about being in medicine is that you can work, it gives you access to any and every population that you might want to work with. So, she had volunteered in a women's shelter, and they did trips to Nicaragua, and they did a lot of like service oriented medical work. And then, they served the community they lived in as primary care providers. And so I really connected with that, because I think that was my goal, was to be able to be of service to people in an important and intimate way, maybe to sort of improve lives. I don't know if that's actually what I end up doing now, but my interest wasn't initially in like health and and medicine, so to speak. It was more about people. And then in college, even when I was still sort of grappling with it, I was realized how interested I was in physiology and how the body works, how you keep it healthy, what sort of things affected the body. So both like psychosocial circumstances, all different kind of things, genetic stuff. It was all really interesting to me. So it felt like, okay, I think this could be a good fit. But I definitely didn't know pediatrics. I was like, I don't really like kids that much. Like, um, in medical school, I thought I definitely want to go into a male dominated specialty because like we need more women in leadership roles and in male dominated things. But I ended up going into a totally female dominated field. I ended up coming to it because I was so interested in prevention and wellness and sort of the more of the holistic view of health and wellness. And being a pediatrician allows you to work with the whole family without really having to do the like medical care of the parents, but still like the health and wellness because
Yeah,
their health and wellness contributes largely to the health and wellness of their children and vice versa. So I sort of got um, I think the benefits of being able to work with families without having to take care of adults medically.
it's a cool perspective. I had no idea about that, about how you drew your want or your passion for wanting to help other people and how you landed into pediatrics. It's very interesting.
Yeah, it's sort of funny when you look back because you think about your brain as like a teenage brain or a young adult brain, and your considerations and things could, um, yeah, your world's just a little bit different. But so it's interesting how you find your way.
Yeah, that's awesome. Okay, so you ended up actually, hold on, before you did that, how did you decide at that point? So was it that take your child to work day? Was that what made you want to go to medical school? Because
So
I feel like that's a huge leap from
yeah,
okay.
that I think that sort of fostered my interest, and I saw it. Like I was lucky enough to see people in my life that I could relate to who lived where I lived, but yeah, so I was lucky to have that exposure and see like, oh, this is something I could do. But I was still like, we'll see. I could, I was still young and was like, I could be or do anything. Um, but in college, the thought I was like, let me just take the pre med requirements, keep the option open. It was a lot of like, let me keep it as an option,
Gotcha. Okay.
which is a little bit of a difficult road to go if you don't know whether
Yeah,
you're gonna
sure.
like turn back. Um, but I think deep down I thought like this is probably the right thing for me, which is why I did it. And the further I got along, the more um, my more it was reinforced that I think this will be a good fit.
That's really cool. Okay, and so I know enough to be dangerous about what happens in medical schools. I know a little bit about how you have to determine your rotations, and some of it is in your control, some of it isn't. So can you
hmm
walk us through a little bit, like how many rotations did you do? What does that look like?
Yeah, the process of
Yeah.
sort of medical training a little bit. So yeah, you're right. It's an interesting, and not all schools do it exactly the same, but
Okay.
most have where you do 2 years of like classroom didactic and cadavers, and you're just like really learning the stuff. And then your third and fourth year are when you're rotating through all the different subspecialties, um, and you get to take electives, and you're sort of really deciding what specialty you want to go into. And then you start to apply for your residencies. And not that anything's ever totally permanent. You can start in one residency and switch, but it's pretty rare just because there's so much that goes into the application process, and the training is obviously pretty rigorous that to redo any of that is not appealing. Um, the hard part for me actually was that, like I said, in college, I thought, I'm going to keep the option open, but I took a lot of liberal arts classes. I did like a lot of writing classes because I really loved that stuff. And the sciences, I was like, it's interesting, but I have to, like, I'm okay with it, but it's stressful because your grade, with medical school, you need your grades to be good. And so it was more like that felt like the drudgery that I had to do. And the liberal arts classes were like, I love this. This is fun and interesting. And when am I going to get to do this again? And I played field hockey in college, so I had my athlete friends and, just friends all in different kind of things, like my pre-med friends, my all different kind of people. You go to medical school and it's like 120 people all doing the same thing in the same lecture hall, the same classroom. Then, like you were saying, vying for your rotations that can be at your home hospital, can be at satellite campuses, and everyone trying to strategize on, their grades and what specialty they're going to be able to apply to, and are they going to be competitive? And I felt a little suffocated. I'm like, oh my God, everyone's doing the same thing, and this is just so much. And I missed having, people around me that were doing all different kinds of things. So I actually took a year off between third and fourth year and did a fellowship, which was becoming fairly common. It's, I think,
Okay.
even more common now, and some medical schools really encourage it. So people will do a year of research. A lot of times it's to bulk up your application for more competitive specialties, but I did a Doris Duke Fellowship, which took me to Malawi, a little country in Southeast Africa.
Okay. Yeah.
And I helped with clinical research projects that were going on there through the University of North Carolina. So that was an amazing year to sort of like get out of the like pressure cooker suffocating sort of environment of
Okay.
medical school, which I did love. I mean, I had friends and I enjoyed it, but it was a little bit, like I said, I sort of missed some of the um, diversity of people and experiences that came with college. Um, that was also really informative just for thinking about broadening my view of humanity, the world, being non-judgmental, sort of understanding things in a different way. And then I came back and did my fourth year, and that helped me also say pediatrics is a good field for me because of a lot of the work that I was doing there was in pediatric research and maternal transmission of HIV and some things that were sort of peds related.
Oh, wow. Okay. I totally agree with you, by the way. I had to travel a lot for work, and I feel like it completely changed my view on a lot of things. I love that I had to do that then. I
Yeah,
don't know that I would be able to do it now with the kids, but
right.
I loved that experience.
Yeah, it
Um,
definitely is easier when you're young and
yeah.
unattached.
Yes, yes. That's really interesting. Okay, so then fast forward, you end up in, you said Mount Sinai in
Hmm.
New York.
Yep.
Okay, and what was that like?
So I went to medical school at Penn State, which is in Hershey, Pennsylvania, and I grew up in
Hmm.
Lancaster, although like, born in Philly, grew up in Lancaster, undergrad at Yale and New Haven. So I had sort of a mix of like urban and suburban or rural experiences. Medical school, I was really like, oh my gosh, I'm like in the middle of nowhere, and it ended up being great for medical school because I really bonded with the other students that were there and we became really close friends because there wasn't a whole city sort of taking us, separating us or pulling people away. But after medical school, I was like, I want to be in a city. So New York was
Okay.
really appealing. Yeah. I mean, I applied like all along the East Coast and California, but Mount Sinai was the best fit for me. I think the program size, um, the diverse patient population, and the mix of like getting bread and butter ped stuff, like stuff that I really wanted to be good at that I knew I would see often, and then also seeing sort of wild and rare things because it was New York City and there was just a lot of volume and a lot of different populations that brought different conditions. So I loved living in New York, loved training there. Kind of like travel in New York, I feel like is like an awesome thing, an awesome place to live, an experience to have. But I don't think I could do it now with kids because I don't make enough money. But it was an awesome place to be and to experience. And then after residency, I stayed at Mount Sinai. I My residency graduation sort of was well timed with a grant that the hospital had gotten that was pretty non-specific. And a young attending was like, I think we should start a pediatric home visiting program because he was a med peds attending and he had done it in medicine. He had rotated through their visiting doctor program, which Mount Sinai's had for a long time. And he was like, I don't understand why we don't have it in pediatrics. And so someone was like, okay, like, yeah, we have this money. We have to figure out how to spend it. Like, that sounds good. So I was hired, and another recent PEDS residency grad from Columbia was hired to start this program, which was awesome. So we did home visits in Harlem we had a catchment of, it was mostly East and Central Harlem, to go into people's homes to take care of kids that were medically complex. So these were NICU graduates, so babies that had been in the NICU and were discharged with special feeding plans, feeding tubes, or just a little bit of, newborn fragility sort of things, and kids who had trachs and G tubes or medical technology and or lots of subspecialty care. I mean, you can imagine, like, you're in the projects, you're on the 12th floor, your kid uses a wheelchair. It's really hard to come into the
Sure.
clinic. So to be able to have a team that can come out to the home was really helpful. We also saw kids with asthma more because the hospital felt like that could be beneficial from a cost perspective because the home factors into your symptoms so much, if there's mold and
Hmm.
infestations, things like that. So we were able to go to the home and see like where were their medicine stored? Did they have their medicine? Did they like which one was the blue one that they were talking about? Or all the things that sometimes in the office you're like, I'm not sure what they mean. When you're in the home, it becomes a lot more clear. So I did that, which was, program development, home visits, some research or program evaluation kind of stuff, which I loved. It was awesome. It was something I wouldn't have expected that I would be able to do, or I wouldn't have envisioned for myself. But when the opportunity came, it felt like such a good fit.
Yeah, I was going to ask. That sounds like all the things you were talking about led up to that. I interviewed my cousin recently who's in hospital administration, and she kept talking about how things were serendipitous and um
Totally.
a- and about like, but it's again like you being in those situations, you had the opportunity to do the things that you liked, and I mean I'm sure that there was some risk involved with that or that program
Yeah.
itself. So it's cool. That's really cool to hear that.
Yeah, yeah, for sure. It was my mom was like, "Why are you doing that? Like, why can't you just do a regular job?" Or like, "Well, what if the funding runs out? And why are you
Yes,
going into
yes,
these?" But it was a really rare kind of unique opportunity, and I was like, "Let's take advantage of it and see."
that's cool. Okay, so then, did you go directly to CHOP following Mount Sinai?
Yeah, that was what made me want to leave was multifactorial, I think. But so I was there for 4 years and it was great. We really got the program started. We were able to grow it, build it, sort of better define it, and set up some systems that made it feel like it would be sustainable. My passion was never in complex care. My colleague who I started the program with, hers was. So, which was a wonderful blend because it took me out of my comfort zone for sure. Like I said, when I thought about medicine, I'm like, I want to be preventive and keep people healthy. And I'm thinking public health and communities. And this was like really sick kids. And so that was hard, emotionally. And had, like pregnant. I got pregnant with my first kid during that time. So that was a lot of anxiety because I was like, you know, I,
Sure.
I was like new things to worry about that people didn't even know existed, or like my sample size for newborns was heavily skewed towards abnormalities, and so you forget that the most likely outcome is a healthy baby. um, but it was a real privilege to be able to work with these families because it's just really inspiring and gives you perspective. It all the things, like it's people with kids who have special healthcare needs are incredible, and they deserve a lot of support, and to be able to have a team that can be really focused on them and their kids was like, it felt good to be able to serve that way even though it made me uncomfortable. um yeah, and I learned a lot. I learned how to take care of G tubes. I learned a lot about a lot of different more rare conditions, and just how to use some of the medical technology. um how parents can really be expert, or really are experts on their own kids even if they're not broad medical experts, and so sort of weighing those two things when you're making decisions for patients and families. But being in New York and working in complex care wasn't what I wanted to do long term. And so when my husband and I were thinking, we want to try to have another kid, I was like, let's move closer to family. I knew I wanted to go back to Philadelphia. He was more like, why would we ever leave New York? And then I showed him how much you could buy a house for in Philly compared to New York. And he was like, all right. And so I was like, so start looking for jobs and we can move. He's like, or you can look for a job and then we can move. And I was like, oh my gosh, like you're a better feminist than I am. You're right. I could get the job. And so I knew they were building the Chop South Philly. I didn't know it had existed before, but I knew they built it because my brother lives in the neighborhood where I live and work in South Philly. And so I had seen it and I'm like, oh, what if I could work there? That would be amazing. And I went on the website, and it turns out that someone I went to college with worked there. And we both were research coordinators at the Children's Hospital of Philadelphia for 1 year between our undergrad and med school years. So like I had the job and then the next year she did the job. So I reached out to her and was like, any chance you guys are hiring? And she sort of helped put me in touch with people. And my husband, who's not in medicine, was like, that was like, how did you
That's
just make that
awesome.
happen? Or,
Yeah,
but kind of to the serendipity point, but also to the like reaching out, picking up the phone, just trying to, asking. And so I interviewed there and at the practice in West Philly, but the South Philly practice was the best fit for me for sure.
that's awesome. Yeah, that's another your network is your net worth,
Hmm.
right? Yeah,
Yeah.
that's really cool. Yeah, you everything leads to this. So now you're still at CHOP. What you, can you talk a little bit about what goes into your day to day? I know I don't know what goes into the back end. Obviously, there is like what people see from the outside. You see patients, you have your schedule, you see patients. But can you talk a little bit more about like what actually goes into the role itself?
Yeah, yeah, sure. It's yeah, probably easier to do like a week than a day because like you
Okay,
said,
sure.
yeah, yeah,
Yeah.
so patient care is the bulk of what I do, which I love and is what I want. So, you have your patient care sessions and we do sick visit sessions and well care sessions. So sometimes you'll see sick visits, which can be they're not your own patients, but it could be. And then other sessions where they schedule you with patients, mostly your own patients that you followed, but also newborn babies or other, kids that haven't been able to get in with their primary or who don't have a consistent doctor. But sort of the other things that people don't see from the outside would be we teach the medical students and residents. So the medical students from Penn rotate, do their pediatrics rotations with us. So we'll, 1 or 2 sessions a week, you may have a medical student with you who's going to see a patient, see the patients on your schedule, come back, present to you, and then you go in and see them together and you're sort of teaching them how to get relevant and pertinent information, how to parse out what are important questions to ask and how do you present that information succinctly and coherently. How do you do an exam? So it's a lot. And sometimes they just have to learn by watching because time, you're like, I'm really behind. But other times you're able to really spend the time with them going through what's your differential diagnosis or what's really important at this age to review with parents. Because a lot of the medical students haven't had children yet. So like everything is new and like there's learning in all the things, whether it's a routine well check or a sick visit. And then we supervise resident sessions as well, and the residents are more autonomous and they've had more training than the medical students because they're medical school graduates and current residents. So they'll see the patients and same, they present to us and then we go in and see the patient as well and go through with them, making sure they haven't missed anything. So that's sort of the teaching piece of it. And then there's a lot of obviously the back end of like reviewing labs and results, making sure you're like up to date on your schedule. Meaning like you have a wait list and making sure people aren't falling through the cracks or kids that you're following. For like poor weight gain or something, and if they've no showed to appointments, social situations, things like that, making sure that we're not missing them. Um, and then behavioral health has become a big piece of of all our jobs as pediatricians, but I have a particular interest in it, so have sort of done a little bit more of the mental and behavioral health care at our office. So I was trained on how to do some of the initial autism evaluations. There's a few different validated scales that can be used. And so we have now some primary care diagnostic, like an autism diagnostic clinic and primary care that a colleague
Wow.
and I are doing, which has been really interesting. And that's just a whole nother world to navigate in terms of services and supports and therapies and schools. So similarly, there's lots of ADHD, anxiety, depression, those kinds of things that we work with patients on because I mean we're not therapists, but p- oftentimes we're the first point of contact if there's a problem at school or a problem at home. They're calling our office to be seen and to sort of parse out what's going on and then how can we take care of them? Do they need medication? Therapy, is there a therapist available, does their insurance cover it? And so we end up doing a lot of like bridging care until they can get connected. And we'll do med management as well. So I've done a lot of like ADHD, continuing medical education topics so that we can so I can feel more comfortable managing these things. Same with anxiety and depression. Those are sort of the big ones that we take care of a lot in primary care now.
That's cool. That's really interesting. Do you I'm jumping ahead here. I normally wait
Yeah.
till the end to ask what's next, but is that something that you think that you're more interested in and going deeper into that in the future?
I think so. I mean, it's so hard because you're, like day to day, you're just sort of trying to keep your head above water. You're trying to keep
Sure.
your house running, your kids, all of that. But that is the area where I see myself. It's sort of like naturally been carving out a space for myself, and that it could be where I can expand. It's even within that space, though, it's hard. Like autism as a whole thing, and then there's
Sure.
different, um, levels of functioning within the autism spectrum, and then there's so much overlap. But I really enjoy it and I see it as a big need for lots of communities. And I like the interplay with like the schools and sort of like what's being done at home, what's being done at school, what supports can we provide. And I think there's some opportunity to make an impact because it's stuff that kids are really, struggling with, or it affects families' ability to function. But I don't know in what context. Like there's the academic setting and primary care and doing it within your existing job. And then there's all these different like telehealth things and, lots of startups that are
Sure.
sort of in the mental health space. But I think one thing I really enjoy, and I think it's a strength, is that I live in the community that I work in, and I really care about my relationships with my patients so that there's a connection and a trust and a rapport that allows us to sort of tackle some of the more difficult things, because it can be really intimate. And when you're talking about like, how are you, reprimanding your child? What things are they doing that
Sure.
are really frustrating you, or that you're not sure about, or and then like, how is the school responding, and how do I address it with them and the teachers? And so, I think some of my lived experience is helping with my own kids, and then also with just having some familiarity with the neighborhood and, um, yeah, with the schools. So I like where I'm working, and doing it more remote or not in a less personal way, I think is not as appealing.
Sure. And I think, I mean, if your story is any indication about, like, I think the best opportunities come up when you're focusing on the things that you do like, and then opportunities pop up versus trying to define exactly what you're going to do next.
It's so true. It's just
Yeah.
that urge to like figure it out is
Yeah,
so
sure.
strong, especially I feel like in the doctor types where you're like, okay, so I'm gonna like, here's the like problem, I'm gonna figure out, I'm gonna fix it. But it doesn't always work that way. A lot of times it has to meander a little bit before you, yeah, really find like where's the need, and where's like what can you offer.
One one of the things so I'm going to give you a compliment here. One of the things that I think it's interesting to hear your background in the areas that you're interested in, because I think one of the things that Allie and I have always appreciated is that you are very, I don't mean to generalize, but there are some doctors who look at things very black and white. And it's like, this is what the recommendation is, this is what needs to be done. But I feel like you do a good job of understanding situationally, like what you were talking about having relationships with the children um and with the families. And so I was going to ask, and I'm trying to think about how to phrase the question the right way, but do you think, because of your kind of your passion around all the things that you just mentioned, around not only just helping people, but looking at health holistically and supporting families and the behavioral health and the mental health side of things, does that impact when you're looking to make a decision to say, hey, everything here, if I'm looking at this without the consideration of the factors that I'm aware of, with your patient specifically, you should do X, Y, and Z. I'm not framing the question. So like I know you can't say this, but I can say this. So like when my son had the issue with, he had a fever and his
I
neck.
was thinking of that. Yeah,
Okay, yeah.
yeah, yeah.
So that's a perfect, like I immediately, because I'm a lunatic, I'm like, this is meningitis. We have to go get it taken care of. And then we were trying to talk through it with you, and I'm like, yes, but these things aren't equal to this. And then we had to eventually go to the emergency room. The doctors there were like, he needs a spinal tap.
Right.
And
I
I was
remember
like,
that.
but everything that you're saying, I don't think that that's the case. And I want to try to understand exactly, like, if you find out that it is, what's the course of action versus what's going into this, because I don't want to put him through this. And so we spoke with you about it. And I know, like, not to put risk on you here, but we ended up in a place where you're like, based on everything that you say and your level of comfort and my understanding of the situation, I agree with what your advocation,
Yeah.
like your
Yeah.
advocacy for
Right. Oh,
yourself.
yeah. No,
Yeah.
no. I was glad you advocated for yourself as strongly as you did. And I mean, I had the luxury of the like Monday morning quarterback or whatever the
Yes.
expression is. Like he had already been there and done fine. But you're right that I do think, um, and it's funny because it kind of goes a little bit to like a little bit of the advice thing, which I guess we'll get to. But
Yeah, sure. You have the perfect segue.
okay.
Yeah.
So like just to address your question first, I do think I enjoy doing my job more when I can put myself in my patient's shoes and realize like I can be on both sides of this. I don't feel like it's a like us and them, which sometimes medical school can frame things like that, like talking about patients as if they're so other. And it's like, no, like we can also be patients. I'm also a parent. Like I can be on both sides of this. And so, although it's easier when there's a protocol and you can follow it and you're like, that's what it is, it's not. Medicine wasn't always so protocolized. And I appreciate so much that we have evidence and science and studies and we have protocols to guide us, but they really are just there to guide us. And so, like, yeah, like you sort of were alluding to with the complex care patients, we really often relied on or encouraged the families to advocate for their kids because as soon as those kids called the doctor's office or walked into the ER, they were going to get admitted or because people weren't comfortable taking care of them because there was so much uncertainty. Which I get it. As a provider, it's really hard to take care of somebody that's really complicated. It's really hard to look at a kid who on paper is saying neck stiffness and fever and saying, okay, I'm not going to do an LP. But when you have parents who say, you know what, here's what I'm observing when you're not in the room. Here's what you can tell. Here are all the reassuring things. I think it's better if we wait. Like that's your job as a parent, or it's great if you feel empowered enough to do that because the doctor should say, yeah, you know what, you're right. The protocol says this, but I see these reassuring things. If you feel more comfortable watching and waiting, like you should be part of the decision-making process, in my opinion. Some people do have a more paternalistic approach, but I think for so many of my things, I do share decision making as long as families are aware of risks
Yes.
and I think as long as doctors are also like can give them like take a step back and think if this was your child, if you were the parent, it's hard to be objective when it's your own kid, which is also what makes it tricky as a provider because you want to remain objective, but you need to also let the parent, contribute some of like what are their priorities, what's more important to them or what's less. Some people are like, I can't miss work tomorrow, like let's just do the catheterization today or whatever. Other people are like, if I can avoid a catheterization for my kid, I'd like to. Can we wait one more day and see, and there it's like,
Yeah.
let's let
And
the
then
family choose.
it's understanding the risk associated with waiting another 24
Correct.
hours or yeah, I
Correct. Or the
totally
risk
agree.
associated with catheterizing and, there's some
Yes.
trauma. Yeah, exactly.
Yeah. And I remember actually when I actually said because we were getting to the point where I didn't feel heard and I remember being like, who do you have kids when we were in the emergency room and everyone said no except for one doctor and I said if this was your kid and you knew everything that I said what would you do and she was like I would wait. And so
Yeah.
that's how we got to, yeah. So,
Yeah.
but I think it's a testament to, it's not about taking shots at other doctors or to say anything
No,
else. It's
yeah.
just, it's a testament to your approach to things is what I was trying to say.
Well, thank you. Yeah, it is.
You're
Thank
welcome.
you. It is very tricky to navigate because you're right. Everyone, providers are trying to do the best they can and keep patients safe, but that's where, yeah, parents have a role. But the reason I was saying it reminded me of maybe you can intro the next segment, I
Sure.
guess,
Yeah.
because there's
So
something.
thank
Yeah.
you. Yeah. Thank you for the segue. So on to the namesake, if I knew then, and just for the sake of it, I'll frame it up the way I always do is there one piece of advice that you wish that you knew either earlier on in your career or your life, or that you would give to someone who's looking to potentially follow in your footsteps?
Okay. So I have a few things that I thought
Okay,
about.
awesome.
One is it was sort of like a indirect piece of advice. It was direct that I was given. So that I would share and pass along. And that was that, to sort of like remember and retain your personality and your sense of humor. And it came about in an odd way. I gave my best friend from home, her maid of honor, I was her maid of honor. I gave a speech at her wedding, which was like kind of a roast of the groom, which I didn't realize how this was like my first wedding. I was still in medical school. Like I didn't know what I was doing. I just come back from Africa and was like in a totally different part of my life or place in my life. And so I was just like going at him. It was just like jokes and roasting him. Um, After the speech, a guy I'm pretty sure he was retired, but he was a pharmaceutical rep, I think. And so he visited a bunch of doctors and he was like, and he knew I was in medical school. And he said to me, he's like, don't lose your humor and your personality. He's like, use that. That will help you so much as a doctor. He's like, I see physicians just like leave their personality at the door, sort of. He's like, it's just like, don't lose that. Basically, this is what I remember him saying to me. I might be getting it messed up, but I try to say that to the medical students too. And really, I think for people in any career or walk of life, like retain your unique personality. And if humor is part of it, or if it's, sensitivity or whatever it is, like don't feel like you can't show that because I need to be professional or I need to be this certain type of way or I have to establish myself as an authority because I think your personality is what makes you you. It's what allows people to like be at ease and connect with you, and your expertise and your hard work and your seriousness when it is appropriate and needed will come through and speak for itself. So like just like use humor and keep your personality. It was like so I was flattered that he said that to me, and then I really took it to heart and tried to share
I
it with
love that.
people.
I love that.
Um, so the other things that I think, well, one of the other pieces of, or like things I think I wish I would have known, and I think I'm still learning it, is to sort of filter advice a little bit. I think that oftentimes people will give you advice or say things, and they might not know the weight of their words or their impact. Like I remember people being like, "Oh, pediatrics, like you can't go into pediatrics, like you'll never pay for med school, like you won't make any money, you won't, you know." And it was so disheartening because I was really excited about, my career and pursuing this, and I had worked really hard and was going to continue to work hard. And I was like, okay, it's good to listen to people and think about the things that they might be bringing up that we might not know about, either if they're older than you or if they have experience that you don't have. Like I had, financial considerations. Yes, it's important to think about your financial future, but thinking about like your priorities and the context of your life is uniquely yours. And people may not understand your priorities or like, what motivates you or what's important to you the way that you do. And so for them, a certain amount of money might not be enough, or a certain amount of time off or whatever it is. But if you don't need that or value that, it's okay to not, to pursue something that they think is foolish or that they would advise you against. So I just think people, yeah, sometimes have
I
strong
think,
opinions that don't
yeah,
apply broadly.
I, I think that that's awesome advice. I was nodding along there because that really resonates with me. I not only would I say I'm an opinionated person that I've learned over time because of I've, how I've dealt with the same thing with me, but this is at a completely different scale. I just think it relates. If you remember, we wouldn't tell anyone the name of our daughter when she was we did the same thing for
Mhm.
my son, but you didn't know us then. But we didn't tell
Okay.
anyone the name because everyone has an opinion
Yes.
until you meet like if I said to you, I'm thinking about naming my baby Joe Schmo, and
People feel like
someone
they can
might
say, oh,
say like,
don't do that.
Joe Schmo, what are you nuts? And then I'm like, okay, now I hate you. We
Right.
can't be friends anymore because my child is named Joe
Yeah.
Schmo.
You hate my
But
child's
if you
name.
meet someone named Joe Schmo, you're like, oh my God, Joe Schmo, that's adorable. And people don't think that way normally. It's the same thing with like, I'm thinking about going into this. Someone may
It's a
say,
great point.
if you're open to my feedback, I have experience in that field or however you framed it earlier. But if you tell someone right now, I'm a pediatrician, I doubt that they would say, why the hell did you choose to do
Right.
that?
But
You
that's
know what
such
I
a great
mean?
point. Yes. Yeah. It's like people think they can just like say
Yes.
whatever if it's has
Like
yet
a
to like
forward look. Yes.
right
Yeah.
come to fruition or whatever. Yeah. Yeah.
I think that's a great point. It's something I struggle with always too. It's always like you try to find the balance of, are you just giving me information and you just want me to accept it and move on? Kind of like the shallow, how you doing?
Hmm.
Good, 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 and
Yeah.
then there's also the, like, are you asking me for advice here? What level do you want? And so I totally agree with you. Or are you just looking to vent and I'm here to listen?
Right. Or you're just,
Yeah,
yeah. And in my case, thinking about how are you going to pay medical school back was a real concern
sure.
and consideration because, it's super expensive. In my case, I was like, okay, there's this public service loan forgiveness. I had thought, I mean, I already, I'm an anxious person. I was like, had already thought like 10 steps ahead. Okay, this is what I'm going to do. I want to work in an academic center. It counts as a nonprofit. I can get loan forgiveness. And even then, I was like, I think I have a plan. And people are like, well, I don't know if that'll ever happen. Like, I don't think that's going to, and it did. It worked out for me. I did my income-based loan repayments and I got my remaining debt forgiven. And
That's
so,
awesome.
yeah, it's like if there's a will, there's a way kind of thing. And also, so it was good for me to know, like, yeah, you need to be thinking about money. Right now, you don't care about money, but like,
Yeah.
wait till you have two
Yep.
kids and you have responsibilities. Like, it's important to think about. But it doesn't mean, yeah, you can't do something. The other thing is, I was like, people don't know how I grew up and like what's a lot of money to me or not. Do you know what I mean?
Yeah.
I was like,
Yeah.
I don't feel like I need, yeah. So people don't always know our context and values. The other piece of advice that I'm just now, I think, starting to like incorporate into my life is own your weaknesses, identify them, own them. And then for me, it's about I think for so long I was like, I need to, like, this is a defect. This is something that's wrong with me that I do badly, that I need to fix, that I need to do better. And now I'm trying to reframe it like, this is something that's difficult for me. Why is this difficult for me? And what can I, if I know I'm like this, what can I do to like support myself, or what things can I put into place to protect myself from it? So like one example is being late. I'm a late person. Like I just don't leave enough time. So I need external accountability instead of like beating myself up or being, thinking about how can I put things like, it's okay to have weaknesses, but then what things can you do to sort of protect yourself from yourself kind of thing. I do well with external accountability. If I tell myself I'm going to do something, it's much less likely to happen than if I tell somebody else I'm going to do it or I plan
Yes.
to meet with them. And so I don't need to be like, I need to just like do this because I said I would do it. I can say, let me get an accountability partner because that's what I need. Like, that's okay. The other piece of advice that goes along with that, which I need to take myself, is mentorship. Just like having a mentor, trying to have someone who's looking out for you, that will hold you accountable and potentially, connect you to resources and things. And mentorship is something we get a decent amount of in school and in training, and then you graduate and it's like you're an adult, and I feel like the mentorship should continue, and it doesn't always. And so that's a goal of mine, actually, to pursue some mentorship and yeah, both like continue to mentor the residents and things, but find more mentorship for myself as I'm thinking like what you mentioned before, next steps. Like there's always, we're always growing and evolving, or we want to be. So having some mentorship to do that would be helpful.
I love that. That's great.
Yeah. The last thing I have on my list is actually like your podcast, because it says ask people their journey or their path. Like I've learned so much by asking the attendings that I trained with or people I work with, like, how'd you end up here? And to your point, they all have these crazy stories of like, or not crazy, but just like not what you would expect. Like, oh, I thought I was going to do this, but then this job opened up in the blood bank. I loved it. I ended up going into hematology. Like everyone just has these stories that are really interesting and kind of inspiring. And it's important to hear. I think it'll spark ideas and yeah.
I love that. I think I had another guest on, one of my former colleagues. Her name is Laura, and she talked about how to avoid the compare and despair, like looking at someone and seeing where they are in their career and saying, why am I not where they are? How did they do that? And I think initially when I wanted to do this was I don't know if it's worth me. I may cut this part, but initially when I was
No, I want to hear.
uh think the idea behind this was I volunteered a lot. I used to get invited back to go to Drexel and speak to business students about like what life is like outside of school, basically. Um, and my career is very niche. I had no clue that I wanted to go into what I wanted to do. And so I started to talk about it, and people had no idea what that was. And how I landed in it is very similar. It wasn't intentional. I took advantage of opportunities. I landed where I am, and I'm very passionate about what I do. But there was this whole like demystifying what goes into it.
Hmm.
And there was this perception of just recently, I was speaking with someone around like they were a little disheartened around the process they're going through, or going through to apply for new jobs. They were looking to do something different. They weren't happy with where they were. They hadn't been getting many offers. And so I was like, you just keep going through the reps, And then it got to the point where I was telling about my experience. And I said, I interviewed when I was ready to leave my previous role. I interviewed at, I don't even know how many places, big name companies too. I got one offer, and it was Microsoft. But the perception though was, the person I was talking to was like, really? Yeah, like I thought you just had your choice. And I was like, no one wanted me apparently. So I landed where I landed, and it worked out, but it's not like I was some
Yeah.
catch. You know what I mean? That was the
Well, you probably were
perception.
a catch, but you also had to go
Yeah,
through all the like rejection. Yeah.
yes.
Before you
Yeah.
act.
So,
Yeah.
but I think like to me, what you said is so true. And it makes it not only do you learn from the people themselves, like around their stories, but it also helps you be not happier necessarily, but be more present in what you're doing and so
Yeah, and more realistic about like it's like the perceived, what social media makes somebody's life
yes,
look like versus what's the reality.
yes,
I love the like avoid the comparison don't compare and
Compare and
despair.
despair. Yeah.
It's so true. It's so toxic and so common to do. And it's such a good point you make. I remember one of my teammates from college, she didn't get into med school. I don't think she got in anywhere. She got waitlisted at Yale, and then she got in off the wait list. So to your point, like now she went to med school at Yale. That's what people know, but like they don't know that she
Yes.
did,
Yeah.
she was ready to apply again and because these things it's just like you're working for Microsoft, but people didn't know that, yeah, there was a lot of people who turned you down, but you had to keep, yeah, going and you land somewhere. But yeah, so learning people's realities, you're right. It's reassuring that like there's failure, there's bumps on the road, there's like you hopefully will end up in a great place, but it's not always in a neat, organized,
Yeah.
intentional way.
Yeah.
Yeah.
Well, this has been a fantastic conversation. Thank you very much for doing this, Maureen. I really appreciate it. But
Thank you for having me. This was so fun.
you're welcome. Before that you go, is there anything else you want to share or plug or?
I feel like I shared everything. The only other thought I have is that now I'm like, I want to do a podcast. Like I was telling you, I feel like it's something that's always been in the back of my head about either parenting or some of the stuff I'm
Yeah.
interested in, sort of like the overlap of personal and professional. And you're very inspiring that you're doing this because it's like,
Thank you.
you're like, I didn't know a whole lot about it. You didn't have experience, right? But you just
I just still know
started doing
nothing
it.
about it. So yeah, I could give you a little bit of like, if you watch the first episode, the quality of video on that versus where I am now, I could give you a little bit of hints there, but I leverage the tools that I have available to me. So I'm
No,
still learning here too.
it's awesome. All right. Well, I'll let you know if I start one up too.
All right. Thank you so much. I really appreciate it.
All right. Thanks, Anthony.
All
I'll
right.
see ya.
Bye.
Bye.